Welcome to Medicare School Daily, where we help you understand Medicare, save money, avoid mistakes, and above all else, get the most out of your Medicare benefits. Now, today's topic is approaching Medicare, 4 important steps. Folks, as you get ready to go on Medicare, you're going to have to make lots of decisions. In fact, we know you want to make the right decisions. And so that's why we're going to show you the 4 important steps. In fact, I would say these are critical, because if you'll follow these steps, you'll see that you will make good Medicare decisions instead of making some Medicare mistake that could cost you dearly. So let's look at these steps very quickly. Number 1, want to be sure that you get educated. Folks, before you make any decisions, you want to be sure that you understand what you're doing. So you want a very thorough education. Now, there is no lack of information when you go on Medicare. You will soon see. Number 1, you will be inundated with ads. They're going to show up in your mailbox. They're going to be in your email box. They're all over the television. Ads about Medicare. You'll also see that there are lots and lots of agents out there. And if this agent gets your phone number, probably going to be pushy, probably trying to pester you until you make a decision to buy a plan from them. Okay, but that is one way to get some information. The third way is to go online. Again, you can search online and never read every article that's available. There's actually millions of articles available online about Medicare, but that is one option. And then others. And what I mean by others is that you're going to find that other people who've made a Medicare decision, meaning they've gone on Medicare, they've made a decision that was good for them. And it may work for them, but it may not work for you. You see, folks, one size does not fit all. And so others are willing to give you their opinion, but you want to be sure that you're careful, because you don't see the same doctors and take the same medications and have the same health concerns as them. But the whole point is this particular path will lead you towards information. But I think at the end of the day, you'll probably be overwhelmed, probably more confused. And so we would encourage you not to follow that particular path, but rather to go to MedicareSchool.com. And here you'll get a concise education, a very thorough education, and very unbiased information as well. Now, the second step is this. Are you going to enroll into Medicare, and when will you do so? Enrolling into Medicare A and B. Now, if you're retired, folks, you are going to enroll into Medicare. You're going to have to start Medicare, because unless you or your spouse are still working, you're going to have to go on Medicare A and B once you retire. You have to. You have no other options, okay? Now, if you're on Social Security, what's going to happen? You're going to be automatically enrolled into Medicare A and B. In fact, the Medicare card is going to show up about 90 to 100 days prior to when your coverage is going to begin, all right? And so you'll be automatically enrolled if you're on Social Security. Now, if you're retired and you're not on Social Security, but we are going to start Medicare A and B, then you're going to have to self-enroll to make that process happen. Okay? You got to initiate the enrollment. You won't automatically be enrolled if you're not on Social Security. Now, others of you, you're approaching 65 and you are still working. And the question is, should you take Medicare? Well, the answer is maybe, right? Maybe. May make sense for you to go on Medicare while still working. Many today are. And here's the way you make that decision. You have to take the time to compare your work plan with what Medicare has to offer you. And the first thing you want to look at is, what's the premiums that you're paying at work? In other words, what's coming out of your check? What are the co-insurance that you have on your plan? Is it 80-20? Is it 90-10? What is the deductible on the plan, and do you ever meet that? What is the max out of pocket on that plan? In other words, if you got cancer, how much would you spend? $5,000, $10,000? We need to know that. And then also, what kind of medications are you taking as well? And so we look at those particular factors with your present group plan and compare that to what Medicare has to offer. And sometimes it's a good decision to go on Medicare. Now, we would never encourage you to go on Medicare A and B if doing so is going to hurt somebody else in your family, maybe a younger spouse or children that are covered. But sometimes Medicare does make sense while you're still working. Now, step number 3, we've made the decision that we are going to go on A and B, and you'll see that there's really only 2 insurance options beyond A and B, and that is to take an Advantage plan, which are called replacement plans, or a supplemental plan. Now, the Advantage plans are given the letter C. These are C plans. And anytime we take an Advantage plan, what happens is that C plan will also include a prescription drug plan. So C plans come with D plans. So we have in and outpatient for the C, and we have the drug plans for those prescriptions that we pick up at the pharmacy. So that's one option. The other option is to take a supplemental plan. Now, if I take a supplemental plan, what that means is A and B is going to pay first. So Medicare pays first, and my supplemental plan is going to fill in the gaps. These are called Medigap policies. These are represented by letters. Most common are F, G, and N plans. And so this is the plans that would fill in the gaps. And then what we do is we add a Part D plan to that for our prescriptions, all right? And so basically the way this works is we pay a premium and we're pretty well done because that supplemental plan is going to fill in most of the gaps or all the gaps. And so we're paying premiums here. Over here, this option, we have low or no premiums. We still pay Medicare, our A and B, but the Advantage plan usually doesn't charge as much because instead of paying a premium, we pay copays. So this is pay a premium and we're done pretty much. This would be a copay system, so we pay as we go. So once you've decided which is best for you, then you need to probably get some enrollment assistance. Okay, most people do not want to go at this alone. And folks, there's really only two options when you get assistance. Number one, you can use what we call a captive agent. Now, captive agents are captive to one company. They're the employees of a particular company. And one of the issues with a captive agent is this. You have limited insurance options. Well, why is that? Well, because their portfolio of products that they're representing is limited to one company, and that company may have maybe 2 or 3 plans, and that's going to be it. So we have limited options, and we also have limited knowledge. And the reason for that is because they're basically trained to sell what the company has to offer, and that's it. They usually provide no other assistance beyond that. They're just trying to get you in one of the company plans, all right? But that is an option. The other option is to use someone like us. We have chosen to go down another path, which are brokers. We're brokers. Why are we brokers? Because we know one size doesn't fit all in Medicare, and we want to give our clients unlimited options. In fact, we look at all the insurance plans that are going to be in that market that you're in, and then what do? We make a comparison of those plans. And so we shop and we search and we make sure that you see everything that's available in your market so that you can make a decision as to what is going to be best for you. And regardless of how you go here, folks, I want you to realize the price is all the same to you. There's no price, no cost at all to use either captive or broker because the insurance company always pays the agents, all right? And so we would recommend that you would have a Medicare School Guide guide you through this process because a Medicare School Guide is, again, going to be unbiased. We look at all the plans, make those comparisons, and then that Medicare School Guide will make sure that you get in Medicare at the right time with the appropriate paperwork, make sure that you get on the right medical plan, A and B, whether that's an Advantage plan or a supplemental plan, and also make sure that you have the right prescription drug coverage, all right? So if you'll use a Medicare School Guide, it will help you through that entire process and really make it hassle-free, and you'll enjoy the experience without having to be pressured into making some kind of a decision that you're really not comfortable with or a decision you do not really fully understand. All right, so that's the 4 steps, and be sure to follow these so that you can avoid making Medicare mistakes. To learn more, watch the related video or check out our most recent video. Also, be sure you click to subscribe for free and get notified every time we post a new video. To watch our complete Medicare workshop, go to MedicareSchool.com. And finally, when you're ready to compare all your insurance options and get free enrollment help from one of our Medicare School Guides, call the number on the screen. See you next time.